Hi, Miss Centros.
Hi.
I'm here to do a test. I gotta do a MRSA test on you.
What's MRSA?
MRSA is a infection that is antibiotic resistant.
Okay.
And that's why I'm wearing all of this funny stuff.
Alright.
Alright? So, these swabs, I'm gonna put one in each of your nostrils, and we're gonna make sure that you don't have it, so I can take all this stuff off.
Okay.
Alright?
Thank you.
Alright, so I'm gonna do that nasal swab we were talking about, okay? I'm gonna put
Alright.
one in each nostril.
There might be boogers in there.
That's alright, I see plenty of that. Alright? This is something
Okay.
we call active surveillance.
Active surveillance is the process of screening patients with a history of MRSA or previous MRSA diagnosis for any active colonization of MRSA. Remember that nose swab? That was active surveillance. Screening that takes place includes a MRSA swab test of the nose, and a second MRSA test is if the culture was negative. 2 tests are done to confirm the absence of MRSA infection. The whole healthcare team is involved in the process of active surveillance, including the nurse, doctor, and lab techs. We are here to keep you safe and get you healthy.
Get this off to the lab, and we'll be back with your results soon.
Thank you, Nurse Nick. Hello?
Hi. Test came back. Turns out you do have MRSA.
Oh no. Am I gonna die? What does that mean?
No, MRSA is a very treatable infection that we can take care of.
Okay.
I'm going to provide you with an educational tool to show you the steps we do to treat and prevent it, okay?
Okay. Thank
Does that
you.
sound all right?
Yeah.
If you're watching this video, you have MRSA.
What is MRSA? The CDC defines MRSA as a bacterial infection that several antibiotics do not treat and can cause a body-wide infection that can lead to organ failure. However, these are some ways to help prevent the spread of MRSA as well as treatment options.
Next is our infection control team, a group of healthcare professionals that work together to prevent hospital-acquired infections. These members put prevention protocols into place, such as hand washing, and oversee that they are effective to keep you and all other patients safe. Overall, an infection control team is quite expensive for a hospital to have, since they have to pay for each members that are involved. Yet, they are extremely important to have to prevent potential outbreaks.
This is the doctor. She studies disease outbreaks and spread along with the epidemiologist within an infection control team. She diagnoses the diseases and prescribes the treatments to quickly get rid of them to prevent further spreading.
A microbiologist works in the lab to identify the specific diseases that are present and report back to the floor if you are positive for MRSA. Thank you, lab team. Nurses play the largest role in infection prevention by providing education and teaching the patients what they need to do to prevent themselves from acquiring or spreading infection. This nurse is donning his personal protective equipment, which includes a gown and gloves. Don't be scared when they walk in your room looking like that. This is for your safety and the nurses. The nurse also can monitor whether or not these actions are taking place and reinforce if need be. He also cleans his stethoscope after leaving your room to keep everyone safe.
The environmental team will be in your room cleaning the surfaces, floor, and around the room to help reduce the spread of MRSA. Don't be afraid to say hello to them when
Washing your hands is a critical factor in preventing the spread of illness and infections. To do so, wet your hands with running water, apply soap, scrub for at least 20 seconds, rinse your hands with water, and dry with a towel. You want to make sure you are reaching all parts of your hands, including wrists, in between fingers, and underneath your fingernails. You also have access to alcohol-based hand sanitizer at your bedside. Easy access right next to you. This is used by putting a pump of it onto your hands and rubbing your hands together, still making sure to reach all of the surface area until it feels dry. There are also hand sanitizer stations outside of each patient room. When you are discharged from your hospital room, it is disinfected using hydrogen peroxide vapor. This is done to get rid of any trace of infection or disease in the room so that there is a decreased chance of the next patient in the room acquiring it. The reason this can work better than the basic manual disinfection is because the vapor can get into all places in the room.
Hello?
Hi, Miss Centros.
Hi.
So I have that round of antibiotics I was talking about.
Okay.
All right?
Yeah.
If this doesn't work, I'm going to try another one.
All right, thank you.
This is called antibiotic stewardship.
Okay.
So if one doesn't work, we're going to keep trying until you get the one that works for you, all right?
All right.
Antibiotic stewardship is a term that means decreasing the overuse and prescription of antibiotics. This can also prevent the incidence of infections such as MRSA, because the overuse of antibiotics can lead to antibiotic resistance, which means that your body does not respond to the medicine anymore, and the infection could get worse. A way to implement antibiotic stewardship is through something called auditing. This means that when prescribing the medication, the doctor must document their rationale on how the antibiotic is going to help and treat the patient, and if there are any risks involved. Another way to stop the use of antibiotics and prevent resistance is to do something called cycling. This is where the patient is prescribed various antibiotics so that their body cannot become resistant to just one of them.
We hope you found this educational video helpful. If you have any questions, please reach out to your nurse and they will help you answer them.
Thanks for watching!